Dear viewers, Assalamu alaikum. In this video, we will discuss fatty liver. First of all, we will discuss what is liver. It is the largest internal organ of human body, and its basic unit of structure and function are known as hepatocytes. And if we discuss the normal physiology of liver, it is involved in detoxification, protein synthesis, storage function, like it is involved in the storage of glycogen, hormone synthesis, and the most relevant normal physiological function of liver that is related to fatty liver is metabolism of lipids, proteins, and carbohydrates. In the previous slide, we discussed that liver is involved in the metabolism of lipids. In normal conditions, how liver deals with lipids, it is involved in biosynthesis of fatty acids, triglycerol biosynthesis, cholesterol biosynthesis, phospholipids biosynthesis, conjugated molecule synthesis, and VLDL biosynthesis. These are the mechanisms, different type of mechanisms or interconversions of different molecules of fats. Means these are interconverting into each other, means sometimes small molecules are being converted into large molecules, means by the process of anabolism, and overall this phenomena is called metabolism. During emergency situation, when body is facing deficiency of carbohydrates, then different pathways for the utilization of lipids are used to provide the body with energy. In this way, lipids are broken down, means fatty acids are broken down to provide energy to the body by the process of beta oxidation of fatty acids that takes place in the liver. And in this way, ketone bodies are formed, that is called ketogenesis. Bile acids and bile salt formation is also the important function of liver, that is most important for the digestion as well as for the absorption of fats from our small intestine into the blood, as well as the breakdown of fatty acids within the liver. While discussing all these things, it is important to say that liver is the dominant site for the lipid biosynthesis, but it is not the storage organ for lipid. It means that liver can synthesize lipids from its small components, but it is not able to store it. Means that after a formation of these lipids, it transport it out of it. And normal lipid concentration, that is almost normal without having any type of abnormality, is almost 3 to 5%, that is in hepatocytes, the basic units of structure and function of liver. Now we discuss how a liver maintains 3 to 5% of the lipids in hepatocytes. There may be two conditions, means when there is more fat in liver than 3 to 5%, means more range from normal, then VLDL and LDL are formed, means low density lipoproteins and very low density lipoproteins are formed that carry the cholesterol to the body tissues, where utilization of these fats takes place, and in this way the level of fats decreases in liver as well as in the body tissues. And second condition may be the low fat in liver. When there is low fat in liver, there is formation of HDL, means high density lipoproteins. These high density lipoproteins carry lipid from body tissues from blood to the liver, and in this way these two mechanisms maintain 3 to 5% of normal lipids in the hepatocytes of liver. In a condition when there is abnormal amount of very low density lipoproteins, means VLDL, or abnormal amount of HDL, and means both are in abnormal amounts, but there is a condition, and that condition is there is decreased amount of VLDL and increased amount of HDL. In this way, lipids start accumulating in the liver and lead to the situation in which there is more percentage of lipids accumulated in liver, more than 5%. This situation is known as, this condition is known as, or this disease is known as fatty liver. Now discuss the causes of fatty liver, that include hepatitis, deficiency of lipotropic factors, as well as some metabolic syndromes also play a major role in developing fatty liver. These metabolic syndromes include obesity, hypertension, diabetes mellitus, alcoholism, as well as hepatotoxic drugs. Diagram clearly explains the stages of liver disease, uh, specifically fatty liver. Depending upon the causes of fatty liver, it is divided into four major types. One is the alcoholic fatty liver, second one is non-alcoholic fatty liver disease, third one is non-alcoholic steatohepatitis, acute fatty liver of pregnancy. These are the four main types of fatty liver depending upon the causes. Now discuss about the common symptoms of fatty liver. Whenever there is problem in liver, such as fatty liver, the normal physiology of liver is changed into the pathology. In this way, the normal function of detoxification, protein synthesis, glycogen or any type of other biochemical storage function, hormone synthesis, as well as the metabolism of lipids, proteins, and carbohydrates is disturbed. These pathological conditions lead to loss of appetite, fatigue, nausea and diarrhea, abdominal pain, weight loss, jaundice of eye as well as skin. This diagram explains the difference between normal liver and fatty liver. In case of fatty liver, bile ducts, hepatic arteries, portal veins, as well as even the basic unit of structure that are hepatocytes are not clearly visualized visualized under microscopic examination. And you can see in the diagram, as the name is indicating, fatty liver means fatty liver showing too much fat. It is not looking like liver. Now discuss the treatment of fatty liver. First of all, whenever any patient is facing disease, he must use some preventive measures. First of all, for fatty liver, the preventive measure that include the preventive measures for fatty livers include healthy diet, exercise, and if a patient is diabetic, he must control his diabetes, means sugar level. And pharmacologically, fatty liver can be treated by using HMG-CoA reductase inhibitors as well as lipotropic factors. If fatty liver is not treated, it leads to too much complications. These complications include biochemical functions are disturbed, liver inflammation takes place, that's known as hepatitis, then several changes in cytological features also take place, and all the components of all the cells of our body are damaged because when there is problem in liver there will be abnormal metabolism, and when there is abnormal metabolism, of course all the parts, all the components and all the cells of our body will be disturbed. It further leads to liver fibrosis, means when liver is being damaged there is recovery mechanism, compensatory mechanism in our body that tries to recover the liver, and in this way there is no normal recovery by regeneration, and when there is no normal recovery by regeneration there is formation of scar, means it leads to the hardening of the walls of liver, and it further leads to liver cirrhosis, that is the most complicated form of liver fibrosis, and this liver cirrhosis is more than 90% chances that it will be changed into liver carcinoma. Thank you so much for listening the lecture.